AMEs might ask, why does the FAA need a detailed clinical progress note, or DCPN, previously called a current status report? When a pilot sees their provider, they often receive an after-visit summary. This document offers a general review of their encounter using non-medical terminology and is usually written in a way that is easily understood by a non-medically trained patient. However, if a pilot has a condition that may be potentially disqualifying, then it must be reviewed by the FAA Aerospace Medical Certification Division. A DCPN from the provider should contain a summary of the history of the pilot's condition, current medications and dosages, including side effects, if any, clinical examination findings, test results, diagnosis, assessment, treatment plan, and all follow-up instructions. So how does an AME help their pilot obtain a DCPN? A DCPN will expedite the certification process for your pilot. There is a link in the video description for a DCPN guide. Your pilot can take this document to their treating physician to assure all FAA required information is provided. For more information, please consult the AME guide.